Hello everyone, in this fourth episode of Point of View, I am here with the three important medical updates of last week. Let's go into the video now. Mucormycosis in COVID recovered patients. A rash of cases of mucormycosis, commonly known as black fungus, is being reported among people who are recovering or have recovered from COVID 19, even as India battles the coronavirus emergency, which has left hospitals overwhelmed and healthcare workers overburdened. India has reported several cases of mucormycosis among COVID 19 recovered and recovering patients, causing blindness or other serious issues. Mucormycosis cases have been reported from Surat in Gujarat, Delhi, and Maharashtra. The mucormycosis infection triggered by COVID 19 is treatable, but if left untreated or if the treatment is delayed, the rare infection can lead to loss of vision and, in some cases, increase the risk of mortality. What exactly is mucormycosis infection? Who is at risk from mucormycosis? What are the symptoms and treatment for the mucormycosis fungal infection? Let's see in detail. Mucormycosis, previously called zygomycosis, is a serious but rare fungal infection caused by a group of molds called mucormycetes. These molds live throughout the environment. Mucormycosis mainly affects people who have health problems or take medicines that lower the body's ability to fight germs and sickness. It must commonly affect the sinuses or the lungs after inhaling the fungal spores from the air. It can also occur on the skin after a cut, burn, or other type of skin injury. Mucormycetes, the group of fungi that causes mucormycosis, are present throughout the environment, particularly in soil and in association with decaying organic matter such as leaves, compost piles, and animal dung. They are more common in soil than in air, and in summer and fall than in winter or spring. 2 to 4 most people come in contact with microscopic fungal spores every day, so it's probably impossible to completely avoid coming in contact with the mucormycetes. These fungi aren't harmful to most people. However, for people who have weakened immune system, breathing in mucormycete spores can cause an infection in the lungs or sinuses, which can spread to other parts of the body. Several different types of fungi can cause mucormycosis. These fungi are called mucormycetes and belonging to the specific order Mucorales. The most common types that cause mucormycosis are Rhizopus species or Mucor species. The warning symptoms include pain and redness around the eyes and nose, fever, headache, coughing, shortness of breath, bloody vomits, and altered mental status, stated the government advisory. In COVID-19 patients with diabetes and immunosuppressed individuals, one must suspect mucormycosis if there is sinusitis, nasal blockage or congestion, one-side facial pain or numbness, blackish discoloration over the bridge of the nose or palate, toothache, blurred or double vision with pain, skin lesion, thrombosis, chest pain and worsening respiratory symptoms. Major risk factors for the disease include uncontrolled diabetes mellitus, immunosuppression by steroids, prolonged ICU stay, malignancy or variconazole therapy. The ICMR Health Ministry advisory stated, mucormycosis is treated with antifungal drugs but can eventually require surgery. As per experts, controlling diabetes is of utmost importance. Reduce steroid use and discontinue immunomodulating drugs. As per the government advisory, medical treatment includes installing peripherally inserted central catheter, maintaining adequate systemic hydration, infusion of normal saline intravenously before amphotericin B infusion and antifungal therapy for at least 6 weeks, besides monitoring the patient clinically with radio imaging for response and to detect disease progression. To prevent the disease, blood glucose level should be monitored post-COVID discharge, and also in diabetic patients, steroids should be used judiciously in correct timing, dose and duration. Clean sterile water should be used in humidifiers during oxygen therapy. And antibiotics and antifungal medicines should be used correctly, it said. The disease can be managed by controlling diabetes, discontinuing immunomodulating drugs, reducing steroids and extensive surgical debridement to remove all necrotic materials according to the advisory. Bees in Netherlands trained to detect COVID-19 infections. In the list of breakthroughs, the fast and unique testing methods developed over the past 18 months to detect coronavirus infection has definitely been a highlight. Now, scientists from the Netherlands have discovered an extremely unique way to detect COVID-19 using bees. This is regarded to be the first time that these small creatures, known for their outstanding olfactory sense, are being trained to detect coronavirus. Adding to the numerous unique ways of detecting SARS-CoV-2, the usage of bees for the purpose serves several distinct advantages. Bees in the experiment were given a sugar solution reward for detecting COVID-19. In this case, a sample on a Q-tip drawn from COVID-19 infected mink. The bees would extend their tongues to receive the reward. With enough practice, they would extend their tongue when they detected COVID-19 even without the reward. Soon, the bees could return a result within a few seconds. Families of COVID patients struggle to get Remdesivir in Tamil Nadu amid shortage. Amid a shortage of the antiviral drug, family members of COVID-19 patients are forced to stand in long queues in Tamil Nadu with no guarantee of whether or not they would return home with a vial of Remdesivir. Tamil Nadu Chief Minister M.K. Stalin spoke to Union Minister for Commerce Piyush Goyal over the phone on Monday and urged him to allocate at least 20,000 vials of Remdesivir each day to the state. Presently, Tamil Nadu is being allocated about 7,000 Remdesivir vials a day, and so far 2.05 lakh vials have been allocated to the state. So what is the use of Remdesivir? To know more, check the description box. So that's it for today. If you find this video useful, please do like, share and subscribe to Dr. Medicine. See you next video.